I'm Dr. Jonathan Aronow, a bariatric surgeon and director of the Center for Weight Loss Surgery at Middlesex Health.
And I'm Dr. Gregory Klimowich, a bariatric surgeon with the Center for Weight Loss Surgery.
At Middlesex Health, we've got a long history of excellent outcomes for our patients. We're well versed in many surgical weight loss techniques, including gastric bypass, sleeve gastrectomy, and duodenal switch.
And we design our treatment plans around our patients as individuals because we know that a customized plan tailored to each patient is what leads to the best outcomes.
This video is meant to give you an overview of what you will experience when you come to Middlesex for weight loss surgery, coming from some of the people who will actually be caring for you while you're here. We hope you'll find the video informative, and we'd be honored to care for you and guide you on your weight loss journey.
Hi, my name is Maggie. I'm a pre-op and post-op nurse in surgical services, and I'm going to talk to you about what we do for our bariatric patients at Middlesex Health. When the patients come into our registration area, we have bariatric wheelchairs for them if they need any accommodations getting into our pre-op area. All of our beds are single rooms. They accommodate from 660 pounds up to 1,000 pounds for their safety. We also check vital signs with bariatric blood pressure cuffs. We also have bariatric gowns for their warmth so they can heal faster. Once the patient is ready in the pre-op area, we apply TED stockings, which are compression stockings to avoid blood clots. We give them a medication called Amend, which is very good for their nausea post-operatively. We also give a subcutaneous injection of heparin, which helps to avoid blood clots as well. If they are in need of using the facilities, we have bariatric commodes. So once the patient is all prepared for surgery, the anesthesia department and the surgeon will come in. We do a patient safety initiative to make sure we have the correct patient and the proper procedure. We bring them into the operating room. They have everything done through their whole protocol. We have a special set of orders specific for our gastric bypass patients.
Hi, my name is Kate. I'm the bariatric nurse navigator and coordinator. As you can see, we have our Da Vinci over here on the side. Our surgeon has been doing robotics for 10 years. We have everything that we need in here for bariatrics. We have the Da Vinci bed, which is weight rated to 1,000 pounds. As you can see here, we have the Hercules sides on here. We have two sets we can put on either side of the bed for their security and their safety. We have the bear hugger here to keep them warm during our procedures. They have their stockings on, their TED stockings on. Our anesthesia has the blood pressure cuffs for multiple sizes. We even have thigh cuffs if needed. And we also have the glide scope for when we do difficult airways. We have a dedicated bariatric team, which consists of 2 RNs and 2 scrub techs as the main people who do all of our bariatric and robotic cases.
So post-operatively, the patients will come in from the operating room to the post-anesthesia care unit. We do our patient safety initiative again. We get them hooked up to all of our monitors and to oxygen. They remain on our oxygen for about an hour after surgery. We also hook them up to our compression stockings, the SCD hose, and to avoid blood clots. Going back to the pre-op area, we touch a lot on education with these patients. We make sure that they know what to expect in the post-anesthesia care unit. We explain that they will have pain post-operatively and they need to be upfront with the nurses to let us know when they have pain. One of the biggest things that they complain about is the pain that they get in their chest from all the carbon dioxide that's been put into their abdomens during the procedure. So they have chest pain, shoulder pain. We make sure that they understand that, and oftentimes we will get them out of bed in the recovery room and take them for walks, take them to the bathroom to alleviate some of that pain and to avoid some of the narcotic use in the recovery room.
I'm Mary Shepard. I've been at Middlesex Radiology for almost 38 years. This is our fluoro room. We also can do regular x-ray in here. This table is our fluoro table. Not moving it, it'll hold 700 pounds. If we're going to move the table around, we're at 450. We have a footstool on the table. If we're going to stand the table up, this will hold 450. If you are bigger than the 450, and for safety reasons, this would come right off. We would stand the table up, and you would stand against it. This also, for if you're 450 or under, this locks into place, so it's not going to move when you stand on it. This table, if you are, like I said, 700 pounds, we would just move the x-ray tube around. We wouldn't move the table. Most of our exams in fluoro are started in the upright position, so we can put the table upright. Now this tube can go up and down however we need it. There are also braces that we can put on the side of the table. They just lock right on. And I tell the patient they can hold on to the side here so that they're not going to fall, because the table can move sideways and sometimes patients get a little, so they can hold on to the handlebars. Okay, so this control panel is the same one that's behind the booth. If the patient is at all any way compromised, the radiologist can be right here next to the patient. This is another option we have, taking images. Usually we use it for barium swallows or swallowing test. It holds 350 pounds, and the belt is larger, so it goes around for safety. It has multiple functions. The feet can go up, the sides come down, the back can go down to be like a stretcher.
Hi, this is Bridget Hill. I work here at Middlesex Hospital. This is the CAT scan department. This is one of two scanners that we have. It is a bariatric CT scanner. The weight limit of the table is 660 pounds. Our aperture is 72 centimeters. When a patient comes down to CT, we do attempt to scan them no matter what their weight is. We do measure their girth as well to make sure that they'll be able to fit into the CT scanner. If it is a problem where the patient cannot fit into the scanner, we do consult with the radiologist if there's another modality available that can make a diagnosis, or that patient is then transferred to another facility where the aperture of the scanner is larger. To move our patients onto the table, we do have multiple devices. We have bariatric hover mats, as well as slide boards and roller boards.
Hi, my name is Ashlyn. I'm one of the nurses here at Middlesex Hospital in the emergency room here in Middletown. When a bariatric patient comes in, we have several different pieces of equipment we are tailored to use for them. Our first thing is the bariatric stretcher. It accommodates up to 700 pounds. It is actually wider than our other stretchers to help accommodate that as well. We have larger gowns. We have larger blood pressure cuffs for bigger arms if needed. We also have extra large Jerry chairs, which have an increased weight limit. And we have these nice brand new, as I call them, the love seat chairs. They're a chair and a half to accommodate a larger size. And for difficult airways, we have specialty supplies in our airway cart for those difficult intubations that our doctors here can use in order to help intubate patients. We also have several bariatric commodes, which can accommodate up to 650 pounds. They are wider for ease of comfort using the commode.
I'm Sydney. I'm a nurse in the critical care unit at Middlesex Hospital, and I'm here to talk about the accommodations that we have for bariatric patients. All of our doors open up wider, bathroom and the doors into each room. We also have 2 rooms with 2 motors on the ceiling lift, which is rated for up to 1,250 pounds. In every other room on our unit, we have lifts that are 625 pounds. We have chairs that are bigger and rated for 445 pounds. And we also have bariatric commodes. Our beds are rated for 550 pounds. We also, if we needed a larger bed, could order from Arjo, which is our bed supplier. We also have low air loss beds that sometimes are necessary for those patients. If the patient has a difficult airway, we have special glide scopes, and if the provider that is intubating isn't able to intubate, we can call anesthesia, and they have other equipment available to help with difficult airways. If we need to transfer a bariatric patient and we don't have the equipment we need, we can call physical rehabilitation services, and they can offer us hover mats, slip mats, and bariatric walkers.
So I'm Emily. I'm the charge nurse of North 5. We take care of post-op patients that have had bariatric surgeries. We have bariatric pathways for each different type of surgery. It involves getting your diet advanced, includes walking around the unit, different medications. All these steps here will show that you will be able to achieve and succeed while you're at home. And we have all special equipment catered to their needs. So we have chairs that they will be able to comfortably fit in. We have SCDs, or compression stockings, that prevent blood clots. We also have walkers that will accommodate their weight. When we need equipment that we don't have readily available on the unit, we will call transport or physical therapy to find the equipment that we will need, and they will bring it for the patients. All of the staff up here also have had special training in dealing with bariatric patients. I really like working on this floor because I love seeing all the different types of surgeries, and I love seeing all the patients get to go home after they've been here. You know, they come here and they're sick, and then they get home and they feel so much better, and it's just so exciting to see as a nurse. It's just so fulfilling.